Time is 6:19.
And we're going in depth. It can affect your ability to grow, your eyesight, even your sense of smell. We're talking about the pituitary gland. And you know that 20% of us get pituitary tumors.
This can affect all sorts of things. We're going to talk to Dr. Pankaj Gore. He's a neurosurgeon with Providence Brain and Spine Institute. Dr. Gore, how are you this morning?
Hi. Happy to be here.
Well, we're glad to have you. Frankly, we don't really talk very much about our pituitary glands, and I suppose we're going to be surprised to find out their importance. Where do you want to start?
Well, the pituitary gland is the master hormone control gland. It's located in the dead center of the head, and it regulates multiple hormonal pathways, including those, as you mentioned, growth hormone, our stress hormones, testosterone, estrogen, and various other hormone pathways.
So what can go wrong with this gland?
Well, the most common thing I see as a neurosurgeon are pituitary tumors, and they can be of two varieties, ones that produce hormones and cause effects related to the hormones, or ones that don't produce hormones and cause mass effect. And it's the large ones that cause mass effect that can lead to visual compromise.
What would cause a cancer on the pituitary gland? Why that particular location?
It's just a fairly common area. There's certain genes that can predispose to that. Cancer is actually very unlikely. They're usually benign tumors. Only about 1 in 1,000 of tumors is cancerous.
I see. So is the pituitary gland a tricky place for a surgeon to try to do their work? I mean, how delicate is that? And if there is a tumor, how much more delicate does that become?
It is a delicate place. It's surrounded by some very important structures, the optic nerves and the carotid arteries. We can get there actually fairly easily going through the nose. It takes us right to the base of the skull. And we use, modern techniques utilize endoscopy, which is a thin metal rod with a viewing lens, and we can work through each nostril with long instruments and get right back to the tumor and avoid manipulating the surrounding brain.
Can a person do anything to prevent these tumors?
Not much. No, I think they arise sporadically, and usually people end up coming to attention for one reason or another, and then we take care of it.
Well, Dr. Gore, because of you, we're aware now. Appreciate it. Thank you much.
It's my pleasure.
Dr. Pankaj Gore, he's a neurosurgeon with Providence Brain and Spine Institute, going in depth here on KXL.